Hello, how you doing? This is Bill Santos, and today is February 9th, uh, 2024. I am still in Delray Medical Center in Delray Beach, Florida. I arrived here December 6th with shortness of breath and a very badly swollen right ankle and foot. And I just wanted to tell you, see if I can do this briefly about my day today, which I'm calling a day in hell. It was absolutely amazing. I experienced just so much pain today. It was unbelievable, but I'm doing all right now. It took 2 Tylenol a little while ago and kind of hanging in there. Basically, what happened was I came in, had a chest X-ray and a CT scan of my chest, and it was determined that I have what they call the wire, about 6 inches long and about the width of a hair, stuck in a blood vessel between my heart and my lung. Today, I had a procedure to address this. I had the X-ray and the CT scan already. This morning, I had an ultrasound of my heart for imaging for the doctor radiologist to look at. Then I was wheeled into the operating room, and then they determined that they needed a CT scan with contrast. The CT scan that I had was without contrast. So I went in there, I had the basic CT scan. They nailed me with the contrast. And I experienced extreme pain in the IV port in my right arm. They told me that my arm blew up. So they took out, I don't know if they took out the IV, but they then proceeded to take about an hour and a half, 6 female nurses and 1 male paramedic to stick me maybe 10, 15 times in both of my arms, trying to establish a needle intravenous, and they were unable to do that. They finally got one into the back of my right hand, which hurt like hell. And then they decided that they were going to put in a midline in my upper right arm. Okay, so the midline, they used that for the contrast, and it was fine, didn't hurt, nice. Got the good contrast. Then I was wheeled into the operating room for the procedure. What they did was they took this thin camera. Basically, what they were putting me to sleep, knocking me out, and just as I was falling asleep, a nurse was shaving me down there, so I was at her mercy. So, gotta go with what they're doing, you know. They basically inserted a camera through the right side of my groin /area up into my heart to determine what to do. The doctor/radiologist said that if it's free floating, then you can just grab it and pull it out. But if it's stuck, then he's going to have to leave it there. And basically it was stuck, so it is stuck in my chest right now for the rest of my life. So that I can kind of push aside. Um, what's happening now, I've been taking nebulizer treatments for my lungs. I'm breathing a lot better, and I can actually talk without coughing now, which is wonderful. And what happened was this evening, I had the wrapping taken off of my midline. No, actually, I had the intravenous antibiotics that I'm on switched from the back of my hand, the IV port in the back of my hand, to my midline. And then around 8:30 p.m. this evening, I had the bandage wrap removed from my midline, and then I had the IV port removed from the back of my right hand. So now I am good to go. I have one midline in my upper right arm with 2 ports, and that's the just the one midline. So I just have one hole, one tube sticking in me right now, and that's it. And I'm taking the antibiotics because I have an infection in my right ankle, and my foot hurts and my ankle hurts, and it's swollen. And my podiatrist wants. Oh, I already had X-rays of my right foot and ankle. My podiatrist wants me to have a CT scan of my ankle because he thinks he sees a fracture in my right ankle. I guess it was about a year ago, I had 2 fractures in my right ankle, so maybe that's related to that. He also wants me to have an MRI of my right foot and my right ankle, but they're still determining whether I can do that because last year I had a titanium metal rod attached to my spine, and I think they're determining, because it's my foot and it's kind of distant from the MRI machine, that it might be okay, but they might want to take precaution because you can't have any metal in the MRI machine because it's a magnetic system, and I guess it'll blow you apart or so. I don't know. I don't know exactly what would happen if you did that. Anyway, that's all, and I just wanted to let you know I'm still here. It's about, I don't know, 11:15 p.m. Is that the right time? Yeah, I guess so. And I just wanted to make a video to give you an update about what's going on. I also received many blood extractions, needles, pricks to check my blood sugar level, insulin injections. I got a injection needle in my belly to prevent blood clots. So I swear I was stuck maybe, I would say at least 20 times today. And I'm going to admit that when they were trying to get the IV needle in me, like the 15th time, that last time hurt so much that I just screamed, and I pushed everybody away and said, "Stop! This has to stop." And then after that, they got the IV in the back of my hand, did the midline, and then, as I told you, the IV is out of the back of my hand. So all is well, almost. I'm still dealing with the infection or cellulitis in my right ankle, right foot, but that seems to be the only issue for me, and I've had this many, many times over the past few years, several years. And I'm dealing with it as I always have. And I just want to thank you all for your support and for your prayers and your well wishes. And I know this video's gone on a little bit too long, but I just wanted to give you kind of a explanation of the day from hell for today. At least I'm laughing and smiling about it now. Thanks for watching. Bye for now.